morning, afternoon, evening, everyone, depending on where you are. Welcome to our seminar. There are two parts in today's talk. The first part is given by Dr. Shuming Bao, who is the director of the China Data Institute and Future Data Lab. He's also been the director of the China Data Center at University of Michigan for many years. He's also a adjunct professor at Wuhan University. He's going to talk about China data for spatial study and COVID-19 impact analysis. Dr. Bao, take it away.
All right, thank you, Wendy, for your introduction. This workshop is co-sponsored by the Chinese Economic Society. What we're like to talk today is about the China data for the COVID-19 studies, and also with a focus on the spatial study. So here are some topics of my presentation today. The number one is why spatial is spatial, why we talk about spatial data here. So the second is what kind of base data of China for the COVID-19 studies. And number three is a resource for COVID-19 research, and also data deployment and sharing. And finally, we'll talk the summary and also discussions and also some future plans. For the COVID-19 studies, one of the probably the most confusing also the issue about is about the data. The data is we see there's kind of inconsistency probably on the report of the confirmed case everywhere in the world, in the different countries, and from the place to place. So I take the example here. This is the confirmed case. The red line is for the China. And you can see there is a kind of peak on February 12th. So this is, it doesn't look right, because this is based on the confirmed report. Because usually the people may be getting infected, but should not, certainly in the same day, and then certainly they're going down, right? So if you look at the data, this is blue data, the blue color. This color is for infected hospital staff. So this data, both data are actually released by the government. So if you look at the time series, there's a significant difference between infected hospital staff and confirmed case for Wuhan. That's the central place of this COVID-19. So there's you can see the difference is the number one, the peak time. So the peak of the infected hospital staff is much earlier than the peak time of the infected confirmed case. And also you can see the range is different. The start from the beginning to the peak time, and then from the peak time to the finally they were declined. And we also see if you do calculate the correlation between the infected hospital staff and a confirmed case, you can see the correlation very low. Almost there's not much correlation between these two data, right? Usually it should be consistent, but as always, it will not be consistent. The confirmed case, there's in the early stage, they're always kind of on the report. But for infective, the hospital staff should be more reliable, because usually hospitals, if they are the hospital staffs, you are infected, they will have a chance to have a test and also be recorded. So the infected hospital staffs and give an idea of what might be the actual, the peak time, the kind of time period, and from the beginning to the end. So this is the issue is how we can use this confirmed the case for the modeling, for the data analysis.
Dr. Bao, we can't see your screen. I'm sorry to interrupt.
You cannot see my screen?
No, we are. The whole thing is empty laptop.
Where can I see that? Oh, it's shared properly there. Okay. Okay. Now you can see my screen?
Yes, sir.
Yeah, okay. Thank you. For some reason, it kind of stopped sharing. Okay. So now the issue is how we can still use this kind of confirmed the report, the case. Many people use that one for modeling, right? For the data analysis. So for time series data, so this is kind of the very common issue for the underreported data, and so there is the kind of significant difference between the actual infected case and the reported case, the confirmed case. But if you look at the spatial distribution, then we can see actually if you look at the spatial data, you can see this is a map for infected hospital staffs. In the same day, we compare you to the same day, and also confirmed case for Wuhan by the urban district and the counties. They are very similar, right? And also we can calculate to see the user scatter chart to see the correlation. There's a high correlation between these two, the fingers. So you can see the spatial data, the spatial distribution shows spatial correlation between these, the two different the index. So even there is the confirmed case still maybe on the report, and the infected hospital staff should be more reliable. But as long as the percentage of the confirmed case is on the report, and for every district and counties, they can consider as a kind of sample of the population of the total the confirmed cases. So it still show the pattern. So you can see with the spatial data, we can still use the spatial data for more reliable data analysis. So that's kind of the difference between the time series data and the spatial data. So here's why the spatial is spatial, right? So the spatial data, the first one, you can see there's several unique values for spatial data. The first one, the location. So from the map we just saw, all the data, the infected, the hospital staffs or confirmed case, they have a location. As long as they are kind of the percentage are similar across the region, so the data can show a kind of the clear pattern and over space. So location is very important to understand where the data is distributed, and also how this virus spread over the space. So because the virus, when it spread over space, they were kind of follow the different directions and take time, and from the central for the regional place and to other place. So we can see a kind of the spatial pattern. Doesn't matter, how the large is the sample. The second one is the time. Even for the many studies, even the time is probably is not the incorrect, or sometimes the time is missing, or data is missing, or is incomplete. but we can still see, because the kind of virus or what things happen on the space, they are kind of take time and spread from place to place. So there's a kind of a time lag there and between different regions. So there's actually the time, the tag on the spatial data. So this kind of time tag can help to under the spatial process and under the kind of the time process. The number 3 is the spatial data. Because every data on the space has a unique location, so that provide a kind of unique advantage for the spatial. The data can, all the data can be integrated based on their locations. So the spatial technology and provide a spatial database provide some very special and advantage for all the data can be integrated in a integrated the database. For virus studies, we probably usually need data from all the different kind of the sources. So these sources, and usually they are kind of separate. So with the GIS, with the locations, so we can and have all the data and integrate together and for virus studies. So here are kind of for the COVID-19 impact analysis. The usually probably there are some primary factors and based on all different kind of the research, like some the virus infection, healthcare, mobility, environmental policy, demographic information, economic information. So those kind of factors, we can find some the qualitative indicators for some factors, like some the population, policies, mobilities, transportation, climate. But for some factors, we may not have the qualitative, the indicators really, or we may not have the up to the updated the data for those factors. So in this case, we can use some the maybe non-structured data, maybe non-quantitative data to derive the data, to get the derived quantitative data index from those the data source, like some social media, like some remote sense data, like some literature data, news policies. So that's the kind of the how we can get the quantitative data, derived data, and once those data has been derived, we have the quantitative data, and then we can use some base map to integrate and all this data matched to say by country, by state or province, or by the counties. So here are some principles for spatial database design. So as for like some COVID-19 studies, it's very comprehensive. They probably they start maybe from some person, household, and then to some community, and then to all the world, countries and world. So all the kind of there is a kind of interactions between different neighbors. So all the global environment may have the impact on the virus and on the prisoner and on the household. And also the virus can start from some individuals and then spread to the global scales. So we need this kind of the comprehensive, comparable, compatible, and consistent data structure. The comprehensive means we need to cover data not only in one single index, but also the data from all the different the field. The comparable means this data structure may be covered not only the spatial, but also temporal, the time, the data structure. It has to be comparable. So from the like some one confirmed case in the country neighbor, in the county neighbor, they should be the same definition, same classification, so that can be comparable. Otherwise, if the data not comparable, you're not be able to understand and what and how these different neighbors and what's the different natures, and also the compatible across the different the data source. For different data source, it may have the different data structures. So we need to build kind of data structure so all the data can be compatible and also consistent. The consistent means that we can have multi-scale data structures. We have similar data structure for all the different neighbors. So for this kind of spatial data, we have three primary factors. Number one, space. All data should have the kind of the report by some administrative units. They report by the county, by the state, by the country. So all those kind of the unit, they have kind of space has a boundary. They understand and where is the boundary and how they can spread. The second, time. So when they develop, there's a time over there. It's a different region and a different time. And all the scales. The scales is that national, global, or individual or community neighbors. That's kind of three primary factors for the kind of spatial database. Where for the COVID-19 and data study, so we say we need there's many data available and from popular free for download, and also the data you can find one interesting the phenomena almost everywhere is most confirmed case data. Those report data are not released by the government, where even originally it might be released by the different neighbors at different kind of government agencies. But it's there's not usually the center, the place, and for this kind of the data. So you have to get the data, retrieve the data, and from all the different government agencies, and then merge together. That's similar in China. That's same in the U.S. So but the issue is, and also the data, there are many data for the COVID-19 data studies, the timing, most of the updated issue. The government properly doesn't have the agent. They can handle this kind of how this data can be merged, how this data can be integrated, how this data can be put together. And so this data has to be updated daily or even hourly. So that's kind of beyond the current structure or current capacity of the government, the operations. So that's in many data actually come from the non-profit organizations or the different kind of the social communities. The one big issue for this one is now we can have this updated data and from the different source, but the issue is which one and what kind of where's how this data can be reliable and what kind of the possible the errors in the data or how we can control the quantities, right? So we don't have the probably more reliable approach and for this one. But for to better understand the data, so we need to have a control at least and for with some reliable data source. So this reliable data source, like what's the total population and what's the kind of the structure of the population and where is the kind of the structure of the by age, by the ethnic group, by the sex, by the occupation, all those kind of information, and I can't actually get from this kind the big data. So those data are released usually by the government, and we call that kind of base data. Those base data, the government spend usually every country they spend lots of money to connect those data, and from like some population sense, economic sense, from all different kind of statistics. So those base data provide an important kind of baseline for those kind of COVID-19 studies, even they are not most updated and up to time, not current data. So for the base data of China, those data include different categories, like some government statistics, The government tax available at national, province, city, and county levels. Usually those data are released yearly. Some data are released quarterly or monthly. Like some the current GDP usually are released monthly or quarterly, so we can understand okay, what's the current the GDP. So the second one is the population sense data. The population sense data provide kind of the sense of all the population household, and this provide very comprehensive information about the population structure. The third one is the economic census data. The economic census provide important information about all the businesses, like some of the hospitals, where is the manufacturing, schools. So all the kind of information provide we all the different many companies also they can probably provide some data on that one, but those data may not be follow the same standard, and so the government's the economic sense data provide more kind of the same standard for all the countries, and also for that kind of standard we can have a control of the quantity of the how many kind of facilities, health facilities, education facilities, business, retailers, and across the region. And also some establishment, also geographical environment. Those data are available for China at different levels. So we have been working with our partners and all those data for many years. So this is an example of the yearly health statistics data. They provide the number of health institutions, the number of persons engaged in health institutions, and also the number of beds in health institutions. So those data are released every year. So that provide a baseline about for the baseline for the health cares across the region, across the country. So this is population sense data, and the population sense data released by the National Bureau of Statistics in China. Usually the only table, so they don't have the GIS map. Let's say it's important to understand where the infected population and distributed over space. It's also important to understand how the total population and distributed on the space. So we have been working with our partner to develop the population data and with the GIS by the province, by the prefecture city, and the county and the township level. So the data provide more than 2,000 demographic variables for the population. And this is covered general information as group, age, household, education, fertility, death, marriage, migration, housing status, and also industry and occupations. Another big source is economic sense data. Probably not many people are aware even the economic sense data of China. Where the Chinese economic sense data is a little different than the economic sense data in the US. The economic sense data actually in the US are based mostly from the sample data. The economic sense data in China is covered all the business in China. So those business economic sense data provide a more the complete picture of all those business across the different region. There's a very detailed classification of industries, almost 900 different classification industries. And for each business, they have some primary products and also ownership, and all different scales of revenue and also employment. With that information, we can find a more complete picture about the business structure and also the business distribution across the region. So this is give you a basic idea and how many businesses are in China from the different censuses. The China has the first economic census in 2004. Then every 5 years have the business the economic census. The last economic census is 2018. So according to 2018 economic census, so there's about more than 20 million the called legal units. The legal units, that means that each individual, the independent the units, they have a legal status. So they can sign the contract and with other units. But for some units, they probably they got economically, financially, they are independent, but they don't have the legal status. Like some one bank or then one franchise stores, they probably have a different store, but they don't have the independent legal status. So there's about almost 25 million, and this kind of called economic units. And these economic units include manufacturing and also service sectors. So the manufacturing is about almost 5 million, about then 20 million is for most of our service sector. The most large, the number of this business in China is actually private units. So there are almost more than 60 million units, the private units, and in China. There are about 7 million are in manufacturing, but more than 50 million are in service sector. So for COVID-19, the most probably the shock impact, the immediate impact is on those kind of private units. Most private units maybe have the food store, maybe have the retail store. So when the city is knocked down, so they're immediately lost business. So that's kind of the primary. And also you can see how those businesses also can be classified by the enterprise, by the government, by non-profit. You can see that for the government, non-profit, they probably have the least impact. But for those business, manufacturing and retailers, they will have the most impact by the COVID-19. So here is a more detailed how this business classified in China. There are about 18 big categories. There are about almost 900 detailed categories. So this is kind of how many hospitals are classified in China. Probably you can see all healthcare service can be classified by 17 the different categories, from general hospital and to a nursing home, then to the clinic. And also in the economic sense data, they provide some other important the business and very important for these COVID-19 studies. One is like some manufacturer of medical machinery and manufacture of the medicines and manufacture and also healthcare the service. Those kind of the manufacturer actually they are and get more opportunities during COVID-19 and a crisis. So all data and we have been integrated, and for those data are available on the China Data Online .com. So those ChinaDataOnline.com and include cover the 3 primary database: statistics database, sense database, and also the China for spatial database. So those databases are used by most universities that work on China in the world. So the China board is different than the China statistics and sense data. Actually, it's integrated, and all the different kind of statistics data, sense data, population sense data, economic sense data, and into an integrated spatial system and for China studies. So with this web-based spatial system, you don't need any tools, GIS tool. You can query and extract data, export the data, and maps, and from those the web-based spatial database, and very easily, and also even generate reports and maps and charts, and from the system. So here are some unique features of the China spatial data. That's a kind of basic the spatial data for the COVID-19 studies. So this the China spatial data connections here, and we addressed here in the China GeoExplore, are probably the most complete connection in the China's history. Cover all the different neighbors from the province and city, county, even township. And it also provide detailed data for nation, province, city, county, district, and township. And also it provide complete coverage, not only the detailed data, but for most data, the big data issues for the China studies, usually the data probably you can get some stats data or from yearbooks. Their data are always incomplete, are always an issue. You can find some data in some province or some counties, but not in some other province or other counties. So this the data here in the China Explorer, we provide a complete coverage for all the region. and from the province, city, county to township. And also all the data are comparable across the time and region with adjusted base map. So one of the big issue for spatial data is usually when the time and move on, and the data may not be comparable because the boundary has been changed, the administrative units have been changed. Similar issues and to the US data. For every 10 years, we have the population census here. But for each census, they may change or their census tract metropolitans. So if you try to get data direct from the Census Bureau or from National Bureau of Statistics, the data are not comparable because from every year there might be some change in the administrative units, not some change, especially in not some prefecture, city, county, and the townships. So in the here we have been make adjustment to those base map. So all the data are based on the same base map. Like on this base map, we have the 2000, 2010, and 2010 comparable the base map. The reasons for these three different base map is 2000 is to match 2000 census, 2010 is match the 2010 census data, and then we also made a kind of comparable base map for between 2000 and 2010. So some data can be adjusted, so they can be comparable and from the different time. And also, most data in the Chinese Explorer are unique. They are not available from official publications, especially those kind of population census data are actually we are compiled from the source data directly. Those economic census data we actually compiled from the establishment, just from individual companies directly. And then all data has been integrated with the GIS maps. So for the government of China, the data, those government statistics, population data, economic data, they are released without the maps. So we actually integrate, process, adjust those data, and then with GIS maps. So that provides some unique features and for those kind of spatial database and for COVID-19 studies. So here are some recent data updates for the Chinese Explorer. You can find those data in the Chinese Explorer. This includes 2017 city statistics, 2018 economic census data. So in order to why the reason is 2018 city statistics, because Chinese city data, they are released by the different the government, the different local government. So some the region they probably have the data released much earlier, but some region they are very late. So that's if we try to get the data for all China, that take 2 to 3 years to get the data at city level for all China. Then that's also we include updated the 2018 economic census data, and also nighttime night data. That data compiled from the rural census data from 1992 and up to 2018. And also now we updated post the daily the COVID-19 the data include those confirmed case, deaths, and recovery, and for China at province and city level. Now in the Chinese Explorer, you can easily and retrieve those data and with the same base map and across different years across the data source. So here is the interface for Chinese Explorer. You can see you can get data, querying data by administrative units. This is by the province, by the city, county, or township. You can also, so this is kind of, you see the manual here of this different data source, the COVID-19, the case, confirmed case, economic census data, 2018, economic census data, 2000, and that's 13, and then census population census data, 2000 and 2010, and also different other data, economic census data from different years. So in the with the system, also you can find the locations, and based on the location, and you can input your latitude, longitude, and then find to reaggregate the population business data, and based on location and spatial distance, they already find how many population within 10 mile, 20 mile, and 30 miles. So those data actually we are being re-aggregated. We project data to 1 square kilometers, and then once you have the querying, you have to re-aggregate it, and based on your location and the spatial range. So those data are never can be found from any official publications. And also in the GeoSpore, you can find some chart, the kind of structure, how the structure has been changed. Population structure for the business structure has been changed over space and over time. So in the last 60 years, China has a significant changes in the structure in terms of population, in terms of business. So with this kind of the chart analysis, you can easily find the national structure, the province structure, even the prefecture structure has been changed over time. So you can also find use this as kind of example how you can use the nighttime light data by the township. You can see how the night data has been changed over time. So for on the space, you can use that data to see how the urbanization. So the nighttime light data is kind of the indicator of the urbanization. You can find, let's say, this is more objective, not a subjective. So it's based on remote sensing data. You can see how the urban spread and over space and over time. So these data are available yearly. This is an example of how the hospital data. You can find those locations of the different general hospitals in Wuhan, where they are distributed. And also you can find a hospital by the counties or by the prefecture city or by the province. And this data, the chart is a new hospital by year. So this actually shows you a kind of policy indicators, how those hospitals are established and over time and over space. And this is provide kind of the migration data and from the population sense data. And one of the big driving factors for the virus, for the COVID-19, is actually the mobilities. I mean, how the people are moving from the space to space. So we don't know, we don't actually have exactly how many people move the space. But based on those migration from the population and census, they might give you some idea where the people move from and from other region to Hubei to Wuhan, and then where the people and move out and from Hubei and to other province. So even they are come from the 10 years ago from the economic sense data, but they actually provide kind of connections. The migration is a kind of indicator of connection, how the people move and between different regions, and also how the people are connected and between different regions. So those are different regions with more migrations each other. They also has more connections. With more connections, that means the virus might be easier to connect, to be spread, and from the Hubei, from Wuhan, to other regions with a more close connections in terms of migration. So this provides a kind of the picture of how the migration and from other provinces to Wuhan, Hubei, and also migration Hubei to other provinces. So this is the map and also data for population change. So you can find so where those the COVID-19 the virus, the usually always start from this central place or from the urbanized the place. So you can find and also for those region, especially for those region with a dynamic population change, that means there are also more kind of the interactions between this region and other region. So this place has usually probably has a higher risk than other region. So then this map gives an idea how the population changed and from the 2010. And you can help us to identify where has more active the population the change towards space. And with the spatial system, you can easily to extract the panel data and from the different time and different region and also different variables. There can also help to generate the spatial weighted variables and spatial activators and from the system. With the data, we can also identify properly possible the policy impacts on healthcare. So we don't know some for historical the data. We probably don't have the complete the connections or the about the policy change there. But with actually every policy, they will have the impact on the population, on the business. So on the population, it can be slow, but on the business, they can be, it's very, usually you can see immediate the impact. Those impact may, on the most significant impact is on the new establishment. You can see if the government policy change, you can see the new startup, the business, if the policy is more encouraging or more kind of relaxed, you can will see more new many new establishment, new business will start up. Otherwise, you will miss the new establishment, new business will start up in that year. So from this chart, from by the years of startup, by the years of the new establishment, we can see kind of the policy impact and from the chart. Okay, so this is some idea of what kind of the base data available for COVID-19 studies. But the advantage for those base data is they provide a more reliable the data source, and for population, for business, for the economic the development. But for those kind of the new virus, and we'll need a more updated the data, the timely data report. So those data, so that's a kind of big challenge, and for those studies always. So that's why the big data now and play a big role for those COVID-19 studies. But those data, so we can see there's many different data from released from different sources, but also the challenges is now we have the data from different sources, but many data they're different format, they're not comparable, and they are not they are not consistent over space to space, and also many data may be just short term, and if you don't have connected that, maybe they disappeared and tomorrow. So that happened and always to this kind of data source. So that's then where we start to work on this project and build a resource for COVID-19 research. So we have when this COVID-19 started in China, when Wuhan started lock down the cities. So we started with the Center for Geographic Analysis at Harvard University, and also Geocomputation Centers and for Social Science at Wuhan University. So we started this joint effort and try to connect data with the data from the different source, and also we build this data in merge this data with some base maps we have, and to make those data comparable across the different source, different region, and also different time, and make those data available for public for research. So this is so now we have been keep the updated this data, and we every week. So those data you can find available on the Harvard's the website. So the objective for this project is we're like to build a kind of permanent connection for the COVID-19 studies, and at regional and global level, and also we like to facilitate this quality research and on spatial spread and impacts of the COVID-19, and with advanced methodology and technology, and also try to promote the collaborations and with the cloud platform we have been working on, and also promote the use of sharing of data in teaching and research. So, and also we like to build the capacity and for future the collaborative the project. So we have several. This is kind of several research team we start up for from the Harvard, from the Wuhan, or from the California RMBS SNAP. Then we expanded to many other institutions, including the George Mason University and also some other university and research centers. So here are some data connections we have been working on so far. Those data sets include those confirmed the case report, the population mobilities, health facilities, infected the patient trace, the flight trends, global news, social media, policies, and meteorological data, air quality, and social economic data. So we are trying to crawl the data and from the website from different sources every day, and those data are actually then be merged with some base map we have here at province and city and then county neighbors, and those data now available and in the database for the public sharing. And these are COVID-19 confirmed case. The data source actually is from the Chinese the website. They compile data for Chinese infected confirmed data case, this case. And then the base data map is provided by the China Data Institute. We're using comparable 2010 maps by the province and prefecture cities. So all the data, other data also use the same map, the mobility data, others hospital data, and those data now available and can be downloaded from this Harvard database and without the restrictions. And those formats include the compressed data map for like some zip file for the maps, and also text the tab format for the tables. Those data are updated daily, have the daily the case. So those index available for this COVID-19 case include new case, accumulated case, new deaths, accumulated deaths, new recovery, accumulated recovery, and also have imported case from other countries. We also include some baseline data, and selected from our big database and in the online maps for sharing. So the population mobility data is another big data source for these studies. So the data source come from Beidou, and also then we use our base map to adjust the data from the internet. Those data are available only from January 1st then to the May. Now they stop and release that data. But those data is provided basically cover and most significant kind of the spread period for virus in China. So now this data include the tables for the include a number of population flew from other provinces and cities, and also number of population flew from the one province or one city to other province to cities, and also the scale of the population flow, and based on the in and out. So the base data, this Beidou data is based on some apps and different apps. So they're not actually the population of the flow, but it's kind of considered as a pattern of the percentage of the sample. So it provide even the sample provide a kind of pattern idea how the population scales flow and change over time, and also how the kind of flow between different cities and province. Another is a health facility data. The health facility we actually crawled from the Ordinary in China, and then we use our base map to aggregate those data and by province and cities. So now we can see there's a different the hospitals available and on the space. This hospital data is different than the hospital data in our economic sense data in the China Explorer. For the China Explorer, there's a standard, say, for the 2000 and say 4, 8, or 13 or 18, those hospitals exist at that time. But for those hospitals and crawled from Ordinary from the website, they may be available now, but they may not exist anymore. Or we also only have the information about the name and location of this hospital, but we don't know and what kind of other detailed information. When this hospital was established, and what kind of the ownership, and what kind of scale. So those kind of the detailed information we are missing, and from this health facility data. So in here we have the number of institutions, we have number percentage by province, per capita institutions, and also we have include the basic population and for different region. And also in the hospital here, the one problem we have for this hospital health facility is sometimes the one hospital maybe have several places, and so there may be some data, some hospital may be overcounted, but then for some other healthcare facilities, they may not be reported in this by this data. Another data is stress data of the patients, and especially for those the patients and outside of Wuhan. So most of the province, they import individual the case. They didn't tell you what's the name, but they tell you where these people are located, and what's your sex, what's your age, and I mean the age, and also which region. So that provide a kind of information about also what time that this person was identified or diagnosed of the COVID-19. So that provide a kind of tracking information of those the patients and over time. The motivation for government to release this data, they can help people to get another data, and where if they we have kind of infected person and near your location, then they can get more kind of prepared. So in this data, they provide some this kind of the index and province, city, county, location data, infected data, diagnosed data, and also patient. Patient include age, sex, and also some other information, the tracks where this person moving, and also move on, and also where's the source, where's the URL. The flight data provide another important information, and for the people's move across the region, and based on the flight, the transportation. The flight, we have the two different sources. One is for the flight in China, and also for international flight. And we spend a lot of time and to crawl this data and also try to correct the problem in the data. So you can see there's a global from data here. We can see clear pattern. The global connectivity actually start from after March 20. So in the decline very significant because other countries start also report the virus. So the many airlines and start to reduce their flight or even shut down. And this is for the connectivity in China. So you can see before on the earliest date on the January 1st, and then on the February 18th, there's the different reductions of the flight. The trend data, and the fast trend is another important source for the population mobility, because the majority, probably many people actually across the province, across long distance, the cities, they are primarily rely on the fast train. It's very popular, very convenient. So for fast train data, we have the railway data, and this traffic data, and they provide we have this data every day, so they can have the data between different cities. So with this one, you can find this is how this kind of the fast train data, the scales of the fast train, how they start decline, and from January 1st then decline, and then after the March they start and recover. And this is meteorological data and weather data. We have this data also every day, and include air quality data, meteorological data, and climate data, and for the different the city neighbors. And those data provide how the climate change during this time. This global news data, and this data provides some policy index, how this policy might change, and provide some policy information and from this connection. Could you mute the microphone? So we are recording. So with those data, and we have been using the base map to integrate our data map in an integrated data products. Could you mute your mouse microphone? Please mute your microphone. Thank you. Okay, so this is our website for this project. You can find from here chinaDataNet.net. So there is a website and to describe this the project, and also with the links to the different data source and available online, so that our data are deployed on the Harvard Dataverse. You can find the unique link for each data set, so you can download this data or maps and without restriction or even without logging. So here we have so far we have the people users from more than 150 countries, with almost close to 300,000 downloaded from the different places. We also have been working with Microsoft China on a cloud platform for this global research, as we share the data on the cloud, and also we make some tools available on the cloud, so you can use the data, because some data may not be and make for public sharing, individual, not some individual case, and patients retract the information. So those data you can access from the cloud, and then we use the tools online for data analysis. This cloud has been stopped right now because the Microsoft China, they only provide a sponsorship for during the virus. And now since the Chinese has already under control, and we are now and work with Harvard University to build a new cloud platform for those share the research and once available. Well, so this is a kind of summary for the COVID-19 studies, and the people probably we understand now the data from different sources, but there's even we already have can get access to those the data from all the big data source. The base data are still very important for understand the basic population, the scale of this the virus, and also possible the factors beyond those the confirmed case, and beyond those spatial the patterns. So those the baseline data provide not only a scale control, but also more detailed the structure information about the population, about the business. And another big issue for this kind of COVID-19 data is they are from all connected by the different agencies and released by different people and different region and different institutions. Those data we can consider as a kind of big data because they generate and almost every day or even hourly. But one big issue is the most data probably follow a different standard. So how to make those data follow the same standard and can be comparable, consistent across the region? That's we need a kind of work. Those kind of work called curation. So the data we provide are different than some data and you can find from other places. Actually, it's the data we have is kind of curated data. The curated data, that means we are trying to follow some standard and make the data and can be comparable and consistent and over time and space. And also for another big issue for this COVID-19 data is for some data that can provide, you can find a quality of the data or index available, like some confirmed case, death and recovery. But for many other data, may not have available quality of data available. That's how to describe the quality and the policy, and how to and quality and to the find a variable for mask use, right? And what's kind of the mobility data? That's a mobility data for China. The Baidu is only available very limited the months. How we can find the data and beyond this time and before that time. So we can use that kind of we can derive that data from some other data source, from some non-structured data. So that kind of the data can be, say, derived from Chinese Weibo. In the US, we can use the Twitter. So that's kind of the directions we are working on. We try to use some the non-structured data and use that data to derive those qualitative data. And then finally, those data, how the data, all this data, probably every data may be incomplete, may have some issue, inaccurate issues, and it's almost impossible to try to correct and all these issues in the data. So the key issue is, but if you can and get data from all the different sources, we can see more clear picture and what's the accurate picture, and for this COVID-19, how it is spread, how it's developed. So how to put all the data together is of course data pattern is important for this COVID-19 studies. So then finally, we need the data. Now it's not only the data, but also need to data training to help people to understand what data means and where I can use the data. So this is some of our planning for this project. So we're trying to develop use the new methodology and tools, and for all kind of the data can be integrated. I mean, it's not only the data integrated, but all this kind of the workflow for data analysis can be integrated. So we are using, and we're actually, for this kind of studies, we probably involve the different data, different methodology, different technology. That's too complicated and for majorities. So we're trying to make this simple and for everyone, for research. So this is kind of sample how we can use these core workflow tools, NIM, and to integrate all this COVID-19 data, spatial data analysis, desktop analysis, and graphic, and then modeling, visualization, and output in one workflow. This workflow can be combined of different kind of the data procedures and modeling and visualizations. And for many people, if the workflow available, you don't have to know how it works in details. You can just change the input and then get the output. But similar to the cameras, you just turn on your camera, you get a picture, right, and then deliver that one. So that's kind of where we have been working, try to develop workflow and for different COVID-19 modeling. So once our cloud available in the Harvard, then we'll make this the workflow available for different COVID-19 modeling, and then people they can test the different model with the different data, or they can change the methodology, use the same data, test the different models. And also finally, and we are actually focused on the how to integrate data and from the different sources for a kind of puzzle. The puzzle means we probably have this puzzle means how we can put all the data together, methodology together, this application together, so we can get a more clear picture and for those stories, not just one picture, one puzzle, right? So we can put all this. This will involve a lot of the data, methodology, technology. So I work with now the Wuhan and Harvard and on this project and for the future studies. So here are some training and workshops we already since early May, we already made a series, several series workshops on the data instruction, data tools, on the data analysis, on literature review and modeling. And those webinars are available now on the Harvard database. You can find those recording and also PPT and also with the data. And finally, we're like to thanks to all the participants from the different universities And also, especially, we would like to thanks to all those institutional member support for China Data Online. And because they are a member sponsorship, and then we can be able to work on this kind of free project and for the COVID-19, the data, the studies. So here's our website for this project and also for China Data Online. If you have any questions, you can send an email to office@chinadatacenter.net. All right, thank you.
Dr. Bao, there's one question in the chat window for you.